Assalamu alaikum. What is the connection between Tesamorelin and diabetes? And the answer is David Thompson, Tech Times. If you are interested in finding out the answer, then keep reading. And the answer is Tesamorelin is a synthetic polypeptide comprised of 44 amino acids similar to growth hormone releasing hormone. The N terminus of the molecule has been changed compared to growth hormone releasing hormone, which leads to enhanced stability and pharmacokinetics. Tesamorelin also goes by its commercial brand name Agripta or TH9507. In the history, highly active antiretroviral therapy was developed for HIV patients. HIV patients in the mid of 1990s and is now the standard treatment for HIV. Soon after, specialists found that although this medication drastically lowered the HIV-related death rate, it led to lipodystrophy in the treated subjects. Numerous investigations have shown that HIV models with lipodystrophy have abnormally low growth hormone levels. Experts showed that increasing natural levels of growth hormones might improve fat oxidation and lower cholesterol. This led to research on the growth hormone axis and its regulation of fat storage, ultimately leading to the discovery of tesamorelin. Tesamorelin, a user's manual. Lipodystrophy refers to the abnormal accumulation and distribution of lipids. Acquired lipodystrophy describes when it occurs after birth rather than at birth. A prime example of a disease that might trigger this condition is HIV. Changes in insulin resistance, excessive lipid buildup, the endothelial dysfunction are hallmarks of HIV induced lipodystrophy and they may be attributable to antiretroviral treatment. The good news is that one may treat this illness and its prevalence reduced using various approaches. One such possibility is peptide therapy, including a peptide called tesamorelin. The FDA authorized the synthetic peptide tesamorelin in 2010 to treat HIV-related lipodystrophy. Timeline of FDA approval in the United States. A new drug application was filed with the U.S. Food and Drug Administration by Threat Threat Technologies Inc. of Montreal, Quebec, Canada in June 2009. Once the US FDA approved the application, the business continued with the medication manufacture and development. US regulators gave the green light to Agripta in November 2010, making it the first and sole therapy for HIV-related lipodystrophy. And the question is, how does tesamorelin work? This answer is tesamorelin stimulates growth hormone synthesis and secretion by binding to and activating anterior pituitary growth hormone releasing hormone receptors. Insulin, like growth factor 1, production is stimulated by growth hormones when they act on many cells throughout the body, including hepatocytes. Low levels of GH and IGF-1 are associated with lipodystrophy in HIV subjects. This may be adjusted with tesamorelin therapy, allowing for better control of lipid metabolism and buildup in the body. As indicated before, the N-terminus of the molecule is changed in Tesamorelin compared to the native GH or H. Because of this, unlike natural GH or H, the peptide is very stable and resistant to enzyme deactivation. Thanks for watching my video. Allah Hafiz.